Protection of the corneal epithelium is part of requirements of the modern cataract surgery in the measure or it contributes to a maximal result at D1. For that purpose, the corneas must be regularly irrigated by the assistant, what requires an excellent coordination between the assistant and the surgeon. Another possibility consists for the surgeon to irrigate himself with the ultrasound probe by taking, however, the risk of collapse of the anterior chamber. We propose here a new system allowing to irrigate the cornea on demand under the total control of the surgeon without any risk of collapse of the anterior chamber. This system uses a small part of the irrigation flow of the ultrasound handpiece. During the phase of sculpting or quadrants, it's possible to irrigate the cornea so much and so often as necessary by a simple 1 or 2 mm displacement back and forward of the US probe. This way, the corneal epithelium is permanently hydrated. The corneal irrigation is always started at the right time by the surgeon. The duration of the irrigation is easily adjusted. In normal position, the irrigation of the anterior chamber is maximal. When the probe is removed from 1 or 2 mm, the cornea is hydrated on all or any of its surface without annoying visual interface for the operator. The translation of the probe becomes integrated easily into the surgical technique. The learning curve is extremely short, less than 5 cases. The system is particularly useful for hard nucleus and long and delicate procedures, but also for standard cases. It can be also used according to the same principle during the cortex removal. The level of withdrawal, the angulation of the handpiece, and its rotation allows adjusting very exactly the quantity and the zone of irrigation of the corneal epithelium on demand. Corneal on-demand irrigation system thus constitutes a simple innovation and a precious help for perioperative protection of corneal epithelium and thus to the satisfaction of the patient at D1. The surgeon just have to perform with the corneal knife a 2 mm longitudinal slit 2 mm from the axis of the irrigation hose on the anterior face of the silicone sleeve.